You are about to view the procedure for collecting a blood specimen by venipuncture using the evacuated tube system. Proper hand hygiene plays a major role in infection control by protecting the phlebotomist, patient, and others from contamination.
Which arm do you prefer?
My right arm.
A patient who has had previous venipunctures often has an arm preference. Proper arm positioning is important to patient comfort and venipuncture success. Place the patient's arm downward in a straight line from shoulder to wrist to aid in vein selection and avoid reflux as tubes are filled. Place the tourniquet 3 to 4 inches above the antecubital area. This enlarges the veins and makes them easier to see, feel, and enter with a needle.
Close your fist.
A clenched fist also makes the veins easier to see and feel and helps keep them from rolling. Select a large, well-anchored vein. The median cubital vein is the first choice, followed by the cephalic. Do not choose the basilic vein unless no other vein is more prominent in either arm. After the vein has been chosen, release the tourniquet and have the patient open the fist to prevent hemoconcentration. Clean the site with an antiseptic such as 70% isopropyl alcohol. This helps avoid contaminating the specimen or patient with skin surface bacteria picked up by the needle during venipuncture. Let the site dry naturally. This permits maximum antiseptic action, prevents contamination caused by wiping, avoids stinging on needle entry, and avoids specimen hemolysis from residual alcohol. Selecting appropriate equipment for the size, condition, and location of the vein is easier after vein selection. Preparing it while the site is drying saves time. The phlebotomist must have gloves on before inserting the needle. Retie the tourniquet to aid needle entry. The fist aids needle entry.
Make a fist for me again.
Uncap and inspect the needle for defects and discard it if flawed. Anchoring stretches the skin. The needle enters easily and with less pain and keeps the vein from rolling. Warn the patient. Line the needle up with the vein and insert it using a smooth forward motion. Place a tube in the holder and push it partway onto the needle with a clockwise twist. Grasp the holder flanges with your middle and index fingers, pulling back slightly to keep the holder from moving, and push the tube onto the needle with your thumb. Release the tourniquet and ask the patient to open the fist to allow blood flow to normalize. According to CLSI standards, the tourniquet should be released as soon as possible after blood begins to flow and should not be left on longer than 1 minute. Fill the additive tubes until the vacuum is exhausted to ensure correct blood-to-additive ratio. Mix the tubes immediately upon removal from the holder to prevent clot formation, using 3 to 8 gentle inversions, depending on tube type and manufacturer. Follow CLSI order of draw to prevent additive carryover between tubes. Place a clean folded gauze square over the site so pressure can be applied immediately after needle removal. Remove the needle in one smooth motion without lifting up or pressing down on it. Immediately apply pressure to the site with your free hand while simultaneously activating the needle safety feature with the other to prevent the chance of a needle stick. According to OSHA regulations, the needle and the tube holder must go into the sharps container as a unit because removing a needle from the holder exposes the user to sharps injury.